Hello? Hey, how's it going? Yeah, we're still good for Saturday? I'm excited for the picnic. Rocio! I felt terrible when I found Rocio like that. I was super scared and I just thought the faster I could do something, the better.
Poison Control Center.
Yeah, hi, my daughter just got into a bottle of bleach.
How is she doing at the moment?
She's okay, but it just happened.
Okay. And how old is your baby and how much does she weigh?
Rocio's 11 months and she weighs about 15 pounds. So when I talked to Poison Control, they walked me through everything step by step, really calmed me down, and they made me feel very good because I was able to help Rocio right away.
Was this the regular household bleach in the white bottle?
Yes, the one I clean with.
How do her eyes look? Are they red, irritated, or swollen?
No, her eyes are fine, but her mouth smells like bleach.
Okay. So bleach can be irritating to the stomach and sometimes can make people vomit. If vomiting occurs, it usually happens pretty quickly. You can give her a little something to drink to take the taste away, but don't feel like you have to force her to drink anything. Rinse her hands and arms with lukewarm water to get all that bleach off.
Okay, do I have to take her to the hospital?
No, this is definitely something we can manage at home. What I'd like to do is check back with you to make sure everything's going all right.
The Poison Control Center called me back just like they said they would. Made me feel really good, and Rocio's doing great.
Poison Control, how can I help you?
Poison Control, how can I help you?
Poison Center, this is Brad. Can I help you?
A lot of times when people call, they're scared, they're panicked, they're embarrassed, and they're worried that something is going to happen to their loved one that they can't handle at home.
Okay. This will probably be just fine, but I need to ask a few quick questions.
If it's something that can be
do you know
managed
how
at
long ago
home,
she
we will
got
give
this?
them specific instructions on exactly what to do.
You can give her a drink, whatever she likes, water or milk.
Well, most people think of the Poison Center as the go-to place to call if their child gets into something, like a medication or a household product. But the truth is, the Poison Center is there for people of all ages and all kinds of situations, like a bite or a sting, or maybe it's a chemical agent or a cleaning substance in the eye or on the skin, or even a foreign object like a coin or a button battery that somebody accidentally swallows. Doctors call the Poison Center as well. They call to get treatment advice for their patients that may have a poison exposure because they know that the Poison Center specialists are really the experts in the management of poisonings.
So there's some thought that both thiamine and pyridoxine can help clear some of the toxic metabolites.
The Poison Center is open 24 hours a day, 7 days a week, 365 days a year, and it's staffed around the clock with specialists who are pharmacists and nurses who have had intense training in the management of poisons.
If you had to estimate how much the container has in it now, what would you say?
A little over 50% of poison victims are children under the age of 6 years of age. Typically 1 to 2 years of age. There are oral explorers. They tend to put everything in their mouth, right? And they don't read, so they can't distinguish between, say, a brightly colored cleaning product and something that's good to drink, or even medicine and candy. And so that's what makes them really the biggest at-risk age group for a poison exposure.
I just turned around for just a second and I saw my daughter with a hand sanitizer bottle. And before I could reach her, she had already opened the top and had it to her mouth. I don't think she got a lot in her mouth, but I do know there's a lot of alcohol and hand sanitizer, so I was really worried. So I ended up calling the Poison Control Center,
Poison Control, how can I help
and
you?
the young lady I talked to told me to take a wet towel and clean out my daughter's mouth and clean off her tongue. And I did that. And when I called there, the young woman who I talked to was very attentive. She was very courteous, and she helped to calm us down because we were in a panic.
There were 2 instances when my kids got into something, and before knowing about the Poison Control Center, I would have taken them directly to the hospital. But now I know there's a number I can call 24 hours a day, and most of the time they can help you right at home.
When you call the Poison Center, we're going to assess fairly quickly whether this is a situation that we can manage or whether or not an emergency department visit is necessary. And really 9 out of 10 times, we can manage things at home. We'll call you back and make sure things are resolving, but we can avoid an unnecessary trip to the emergency department.
Yeah, I can help you with that. I just need to ask you a few quick questions to determine if everything's going to be okay.
So we'll be the first to tell you if it's a true emergency. And we'll call ahead to the emergency department and we'll let them know you're coming and what the nature of the situation, so they're prepared and they know what to expect.
When Natalia was a little girl, my mother was visiting us and she got into her diabetic pills. They were in her suitcase, and so Natalia had the bottle with her, and I said, Natalia, did you take these? And she said, yes, I thought it was candy. So I immediately panicked and I called Poison Control.
Poison Center, this is Brad. Can I help you?
Hi, my daughter just took my mother's diabetic pills.
Okay, I will help you with this. Let me ask you a couple of questions. How is she doing right now?
She looks fine.
Good. How long ago did this happen?
5 minutes.
Okay, well, I can help you with this. I need to ask you just a few more questions. First of all, I need to know what the name of the medication is.
The person I spoke to at Poison Control was great. He was really polite. He got me calm.
This is a medication that can cause some problems, so I'm not really comfortable watching her at home. We're going to need to take her to a hospital. What hospital is the closest to you?
The Children's Hospital.
About how far away is that?
About 10 minutes away.
Good. Do you have anybody who can drive with you to the hospital?
Yes, my mother's visiting and she can come with us.
Fantastic. Well, let's take her and also take the bottle with you to the hospital. I'm going to call the hospital and let them know you're coming, so go right to the emergency room and please drive carefully.
If I wouldn't have called Poison Control, I don't know what I would have done. I don't know what I would have done.
Hi, it's Dr. Kadish. How can I help you?
Hi, Dr. Kadish. This is Brad at the Poison Control Center. I've got a 2-year-old girl who's heading your way. She got into a bottle of glipizide and it looks like she took one of the 10 milligram tablets.
Okay, and how long ago did she take the medication? So when the Poison Control Center calls us, it allows us to prepare for the patient as they're coming on in. They can give us information about the patient's age, the medication, and it allows us just to get ready. And as soon as they come in, we can take care of them pretty quickly.
You know, I think sometimes people are afraid to call the Poison Center. Maybe they're embarrassed. Maybe they're concerned. We'll think they're neglectful if their child gets into something. They may even be worried that we might report to Child Protective Services or to law enforcement. But we're not here to report. We're here to help.
It's a little embarrassing, because I was in the kitchen with my daughter and she still managed to get the hand sanitizer bottle. And when you call the Poison Control Center, they don't make you feel embarrassed or guilty or like you're a bad parent.
The benefits of calling Poison Control are they'll tell you things that you could do just at home.
The number covers all of the United States and its territories. It is toll-free, and when you call the number, you will automatically be directed to the number for your area. You can find the telephone number on the inside of your phone book by where 911 is located. You can also do an internet search on your telephone, your tablet, or your computer for Poison Control.
Poison Control's phone number is everywhere, on our phones, my husband's phone, my mother's phone.
I also gave the phone number to my mother because she watches the kids for me sometimes. And my mother really doesn't speak any English, so it really helps us to know that there's somebody there 24 hours a day able to speak Spanish with her.
They always assure you if there's something you didn't understand, you can call them back, and that makes me feel good.
It's a common tendency for parents to go to the internet if their kids get into something, but frequently they end up wasting time, and a lot of times that information could be incorrect and potentially harmful.
Certainly if your child gets into anything, a great resource is the Poison Control Center. They have fabulous knowledge. Either they can give you the information or they can get a hold of someone that has that information, and they'll be able to at least direct you to the best care for your child or a significant other.
Being the director of the Poison Center is a very rewarding job. We help people of all ages in all kinds of situations every day. We're able to quickly assess and reassure them that everything's going to be okay, that maybe we can avoid a trip to the emergency department, that their child or their loved one or they're going to be just fine.